okay? Are you tired of picking your body apart in mirrors, car doors, or when you're walking by a window as you're window shopping? Feel free to type 1 in the chat. You can also type 2 in the chat if that means no. How about this one? Living with chronic pain that feels like it will never leave your body. Okay, we got some ones coming in. How about this one? Overwhelmed with feeling unsure of how to safely move your body and start and even keep a movement routine. Okay. This is helping me just understanding where you're at. How about this one? Wishing you had that pre-baby body back, or maybe you're frustrated with weight gain as you move through menopause. 1 or 2. Let me know if this is something you feel you're struggling with or not struggling with. Okay. So as you can see, we're hitting different what's the word? Phases of life for a woman. How about this one? Stressed out with being social because the thought of finding something to wear makes you actually want to be antisocial. And no one likes putting away that pile of clothes on your bed after you just can't figure out what to wear. How about this one? Frustrated with feeling physically weak to do the things you want to do. Or I hear this a lot, the exhausted cycle, and I go through this, of being good for 2 weeks and then falling off the wagon. All right, this is striking some chords here. Or maybe you're like one of my clients here. So something they struggled with was they had a bunch of equipment that her husband was using, and she just like, I have this stuff, I just don't know what to do with it. Maybe you're in those shoes, right? Now, on the flip side, are you also looking to learn how to accept, appreciate, and celebrate your body? Wanting clarity on how to move safely and understand what a sustainable movement routine can look like for you. Craving the feeling of being pain-free, more strong, a physically capable person, friend, parent, mama, partner. Wanting to dress yourself with confidence so that there's ease in going out and the thought of actually enjoying your social life is possible. Or maybe you're craving a new experience where perhaps a fitter and stronger body can actually help support this pursuit. For instance, going on a trek in Rwanda. And I had a client that I helped, that I supported with that goal, which was so cool. So if any of these resonate with you, so I see ones in the chat, please get cozy, grab your tea, your blanket, because you're in for a real treat. And thank yourself for showing up today. Because there's a female fitness revolution going on. On the left here, we see the good old Jane Fonda, right? So gone are the days where we're doing aerobics classes, barely wearing anything, probably not. Nonetheless, you get my joke. There is a shift to more women in the gym, learning how to lift weights and become stronger, not just for physical aspects, but for mental, emotional, and social benefits. Let's understand what strength training actually is. You'd be surprised how many women are like, oh, I actually didn't know that. It's a type of physical activity that increases muscle strength and size by making muscles work against a weight or force. The weight or force could be gravity, right? That's why there's body weight training. There's use of free weights, weight machines, and resistance bands. Okay, I want to hear from you. Why should we strength train as women? Share whatever benefits you've heard of, maybe from a friend, maybe from a partner that you know of in the chat. I want to just hear where we're at here, because there might be overlap with our knowledge. If we don't know the benefits, that's okay. We're here to learn. Denise says gain more confidence. Yes, that's actually one of the benefits we're going to talk about today. Anyone else? Any other benefits come to your mind? Jess says muscle deteriorates as you age, especially for women, right? And we're going to talk about hormones too. So it's important you can start as much as you can. Absolutely. I've worked with 7-year-old women, and they were just diagnosed with less osteoporosis or sarcopenia, and we're able to improve their quality of life through strength training. The needs our body have as women is, yes, thank you, Tiffany, for saying this. And there's actually not had a lot of research out there supporting women's health, because our hormones and our systems, the way they're designed, is so different than all the white men that are studied. And because it's so complex, not a lot of people want to study this sex. Nonetheless, it is changing. It is changing. Thank you so much for sharing. We're gonna continue to bridge on these ones. First one. Increased strength and pain-free living. So feeling physically capable and pain-free to do the things that you want to do on a day-to-day basis, such as carrying your grown child or grandchild, having the strength to go on hikes, or dare I say, when you travel, be able to grab your luggage and put it up in the overhead carry-on compartment without asking for help. Or maybe it's doing physical labor in and out of the house with ease. Now, how does strength training actually make this happen? What happens is it improves the neural connection from your brain to the muscle groups. So the muscles become more conditioned, which helps you move efficiently through life and in sport. And this client, she was very hesitant for starting a strength training program because she was worried about hurting her back. She was diagnosed with a disc bulge, really nervous about movement. We got her to a point where she wanted to continue working together because she was pain-free and she was getting stronger. I love hearing those stories. Okay, improved metabolism and decreased risk of chronic disease. So when we have a higher muscle mass coupled with increased insulin sensitivity, which means the movement from our blood sugar, our sugar in our blood, to our muscle cells or any cell in our body is easier. This means the storage capacity for blood sugar in the muscle is expanded, right? And this helps decrease the risk of chronic disease like type 2 diabetes. And this is why strength training is also recommended alongside cardio for fat loss, as it speeds up your metabolism and it helps you burn more calories at rest. Right now, when you and I were just sitting or standing, whatever you're doing, when we're just in a resting phase, we burn more calories because we have more muscle compared to any other training modality out there. Now let's pay attention to this picture here, okay? So we see 2 kilos of fat and 2 kilos of muscle. Now muscle is what we call a very dense tissue. This is why muscle takes up less space at the same weight of adipose tissue or fat tissue. And this is also why using the scale to measure progress can be a flawed tool, because it's not showing what your body composition is composed of. There are many household scales that measure body composition, so that's something that you can use to measure progress. Now I really want to just send this message home that it doesn't mean that you need to have the ittiest bittiest waist to be quote unquote healthy. Many women actually carry weight around their midsection and live without chronic pain, without chronic disease, and have a normal blood panel, which is very contrary to what we're told in medicine and in society. Number 3, improved heart health. Okay, so with muscle being an extra storage for calories, it can help reduce visceral fat. So that's the fat around our midsection that pads our organs. When we have high amounts of this type of fat, it puts more pressure on our organs, leading to heart-related conditions like hypertension. I want to just focus on this picture here. This woman carrying 2 jars of pickled deliciousness there. Research has showed that having a higher grip strength is associated with lower blood pressure, lower triglycerides, which is a type of fat in the blood, and higher good cholesterol, what we call HDL. Also, it has shown a decreased risk of future disability and death. So not only does having more muscle and strength keep us active and make the process of opening jars a lot easier, it has the additional benefit for our heart health, which not many people know. All right, then Denise said gain more confidence, and we're on number 4, increase confidence and well-being. So what lifting weights does is it essentially proves to ourselves that we can do hard things. And this skyrockets our confidence because we actually feel capable. Our relationships improve because we feel better about ourselves. We perform better at work because we're thinking more clearly. We're a more present partner, parent, friend, grandparent. And strength training for myself and the women I've supported have really helped us build a mindfulness practice. Because when we lift weights, we have to be very intentional with the muscles that we're using and engaging. Because if our mind is somewhere else and we're not paying attention to what we're doing, that can increase the risk for injury. So this can improve mental health conditions like anxiety, depression, and improve overall mood. Another thing that when we're talking about confidence and well-being, some women also report gaining the self-trust to stand up for themselves in new ways, which contribute to overall mental well-being. This one client felt so confused. I don't know how to warm up. I don't know how to stretch. I don't know how to squat. Confidence to actually carry out a movement routine is a common one too. Okay, we're hopefully coming out of COVID now. Number 5, improved immunity and longevity. So strength training improves the number of white blood cells and proteins we have in our circulation, which, as you can imagine, decrease the likelihood of us getting sick. And let's say we do get sick, we can experience a speedier recovery. And when we're talking about longevity, women who are stronger tend to stay more functional in older adulthood. So not only do they live a longer life, they also experience what I call a deeper life because they can do more and get more out of life. All right, this one's one of my favorites. So strength training can improve your body, your relationship to your body. It can be very healing for people women who are in eating disorder recovery, or maybe they're showing disordered eating practices, or maybe they're experiencing what we call body dysmorphia, which is excessive worry about one's appearance. Now, how does strength training help this? Well, it helps us move towards body acceptance because we focus on how we feel and how we perform instead of how we look, which is much more empowering to connect with ourselves on that deeper level. And this is more of a taboo topic. I know for myself and some of the female clients I coach who have experienced physical or sexual assault, strength training can help us feel more safe in our bodies and help us feel more physically capable in case there is a need to protect ourselves. This one client, she's a CEO, high achiever, just go. She's a doer. So she was so disconnected from her body through breathing, through soft tissue release with teaching her how to massage using different tools from home and then getting her into strength training. She's like, I actually am in tune with my body, which is something that I love women to experience more. And strength training is a tool. It can be a tool to do that. All right, we're almost going to take a break. This will be the last one before movement break. Okay, so when we strength train, it's actually normal for our metabolism or our appetite to increase because this is our body's way of building our metabolism. Strength training helps us become more connected to our body, and we begin to honor our hunger and fullness cues. And then we also learn how to fuel our body because we need to perform in the gym. There's nothing worse than feeling low energy and forcing yourself to work out. Also, it can improve our relationship to food so we can actually enjoy social situations when we're dining out. This is actually one of the questionnaires from one of my recent, she's 2 months in the 4-month program. She actually didn't know she was able to squat 20 pounds or row 20 pounds. The accountability has been really helping. And she's just like, I didn't expect myself to be this strong, which it's kind of cool to wow ourselves sometimes, right? All right, what would a webinar be about movement if we didn't do any, right? So if you're sitting, you can chill out sitting. If you want to stand and join me, you can too. I'm making it accessible to both situations. So with this one, let's get curious about our body. We're going to inhale, raise our shoulders up. Excellent. Exhale, push your shoulder blades down into your pockets. Let's do 2 more, everyone. Inhale up. And exhale down. Inhale for 3 seconds. 3, 2, 1. Exhale for 6, 5, 4, 3, 2, and 1. All right, shake it out. We're going to do one more. Actually, no, we'll do 2 more. Let's do right ear to right shoulder. Okay, now this one's important. I know everyone's trying to do the opposite on what we see. Oh, hello, Kitty. With this one, let's see if we can. Wonderful. You might feel a stretch there. We're going to drop our chin down to our chest. And then we're going to bring our left ear to left shoulder. So we're essentially doing half circles. Move slow and with control. Let's get curious about where we're holding tension in our shoulders. Relax your eyebrows, your jaw, your body just 5% more. Let's cue in breath. Inhale, swing. Exhale, swing. Last one. Wonderful. One more swing here. Okay. Next, hands out, high 10. Pretend you're high 10ing me. Let's reach now. Closer, closer, closer. Good. Round out your back like a scared cat. And then you're going to open up, big hug, chest towards the sky, tall, proud chest. Confident version of you here. And then let's round. Let's cue in breath. Inhale, open, big hug. Exhale, round. All right, shake that out here. Wonderful. Thank you for joining me. I hope that felt good for you. We're going to finish with the second half of the benefits now. Okay, increased bone density. So the stress that comes from tugging and pushing on the bones that occur during strength training nudges what we call bone forming cells. And this results in stronger, denser bones. And this can contribute to staying functional and prevent osteoporosis, which is low bone mineral density, and sarcopenia, which is muscle loss, and decrease the risk of disabilities. Strength training also reduces the risk of falls and also fractures from falls. So what that means is, let's say you're strength training, you jump off the curb, you fracture a hip or your femur, your recovery can be a lot faster when you do have stronger bone density, more muscle, more strength. Improved mobility and joint health. So when strength training with optimal technique, we perform drills that help improve your range of motion in a specific movement. So we can see this little one here in that beautiful squat position. Many squats aren't comfortable because we have limitations in our ankle and our hips in terms of mobility. So not only are you just lifting weights, we're training your body how to move more optimally, to allow yourself to actually experience the fullest range of motion you have, and then strategically loading it safely. And what this does is it builds tolerance in the joint. So you can imagine this can increase the density of our tendons, our ligaments, which thus decreases the risk of chronic pain and injury. And if you're managing chronic pain, like many of us in this webinar, it can help manage those symptoms. There's one client here who is a badminton player, and she has just become so in tune with her body because we've been strategically focusing on joints that were causing her so much pain. She described it as, I feel like an agile ninja after us working on breathing and all these different types of movements. Number 10, improved health in motherhood. So strength training before, during, and after pregnancy, when medically cleared to do so, can, to name a few, prevent or improve depression symptoms, decrease risk of high blood pressure associated with pregnancy, gestational diabetes, low back pain, and urinary incontinence. And also just really helps decrease postpartum recovery time. Now, this message I'm going to share is very important. So for the mamas out there, I want you to hear this with wide open ears. So for those of you who have had children, you really want that pre-baby body back, I want you to remember that your body performed a miracle. You have brought life into this world. Giving birth is a trauma to the body, and it takes time, effort, and patience to recover from that. So having appreciation for what your body is able to do and continue to do, I really hope that provides assurance that, accepting where you are today, and also the importance of taking small steps. Let's pay attention to this picture here. We see a mother, and I'm going to make the assumptions, both of her daughters there. Now, it is my mission to get women strength training, just strengthening their bodies, because when we do, we are able to lead by example for children and young girls all around the world. And when we show girls that their value in life is not placed on how they look, and instead focusing on how our bodies are capable and how we can use our other gifts like intellect, work ethic, kindness, that is what really brings value to the world. So we're talking about generations of improvements if we continue to lead the torch. Okay, we had a couple women talk about hormones. Improved hormone balance. Actually, let's do a check-in. Can you type in strong in the chat if you're still with me? We got Jess here, we got Tiffany, Sandra, Joanna, wonderful. All right, we'll see if one of the kitties can type strong too. All right, so building strength and muscle mass depends on muscle building hormones such as testosterone and other growth hormones. Now, I hope this is the last time you will have to have this myth dispelled of getting too bulky with strength training. Now, women produce testosterone. We don't produce nowhere near as much as our male counterparts. They produce 10 times more than we do. So with that being said, what most women actually don't know is that estrogen and progesterone are two hormones that affect the muscle building process as well. Estrogen supports muscle growth and protects your bones, joints, and tendons from injury. We can see with age that estrogen levels go down as we move through perimenopause into menopause. And with that being said, how does strength training help this? Okay, what happens is strength training actually mimics what the hormone estrogen does on the muscle cell level, which in turn helps us increase or maintain or increase our muscle mass and bone mineral density through perimenopause and onwards. And it's also important to know being active in general helps improve our perimenopausal symptoms. Enhanced libido, I love taboo topics. So strength training increases what we call youth promoting hormones and testosterone in women, which improves sex drive, energy levels, and overall vitality. Human growth hormone plays a role in increasing muscle mass, decreasing body fat, supporting the immune system, and boosting the metabolism. Also, women who lift weights tend to feel more confident or comfortable in their body and confident, have better mobility and less pain, which can make the act of physical intimacy much more enjoyable. 13, we have 2 more, okay? Long-term studies have found that strength training led to overall benefits in cognitive performance, specifically around protection from degeneration of certain parts of the brain, particularly our frontal lobe, that's involved in executive functions like planning, memory, attention, and self-control, and also learning. Last one, improved performance in sport. So whether your sport is tennis, hiking, pole dancing, momming, just being a strong, a stronger person that's working on their movement quality outside of their sports setting, can really help improve your performance because you are building a stronger, faster, more agile body through strength programming. And this client was really happy with her progress in stretching in the right places and incrementally building volume throughout her program to allow her to play in her sport. So I want to hear from you. Which benefit resonated the most with you? Which one really said, ooh, that's interesting. I want that. Type the number in the chat. I want to see which one was which handful were a hit today. Okay, we have a 2. All right. Amy's going for a hat trick. 1, 12, and 1, 2, and 12. 1, 2, and 12. Nice. Who doesn't want a better libido, right? Number 9, improved mobility and joint health. Yes. Yeah, it's always fun to feel light on our feet. We have 7s, 1s, improved relationship with movement. This is very healing for women, especially if you have experienced a lot of trauma from diet culture, right? I would choose all if I could. Going for the home run. Alrighty. Next question. I'm full of questions today. How often have you strength trained in the last week? And I want to preface this question. You can say 0 because that's okay. I have weeks where I don't strength train. All answers are welcome here. Okay, we got a 0, we got a 1 twice. That's okay, because I'm going to talk about clients in different scenarios, and maybe one of these scenarios potentially can resonate with you. Story time. So we have Ashanti. She's 20, and these are different names than the clients that I'm working with. She's 26 years old, ex-varsity rower. She has low back pain and she was very scared of provoking it. She's stable now. She doesn't have any back pain symptoms. They train on their own 3 to 4 times a week, and they meet with me once a month. We were doing weekly, we moved to bi-weekly. Now she's quite independent. Then there's Mimi, 34 years old. She is a hardworking entrepreneur. We're focusing a lot on gentle movement because strength training is just a little bit too much for her body right now. And we're focusing on a body connection. So not strength training yet. I'm seeing her 1 time a week, and it's still health coaching, right? So we're talking about habit building. We're talking about sleep, gentle forms of movement. Then we have Kristen. She's 50 years old. She has a history of eating disorders. She's post-menopause, really focused on improving her bone density, and she is training on her own 2 to 4 times a week. She does travel quite a bit, so she really tries to make it work. I was seeing her weekly. Now I'm seeing her bi-weekly because she's getting the hang of things. Then we have Valerie. She is a previous runner. She unfortunately has a history of assault, and with that, has troubles connecting to her body and feeling safe. So a lot of what we do, I see her once a week, and she does her own movement. She does yoga with little bits of strength training kind of sprinkled in between. So what's the moral of the story? Ladies, we all start somewhere, and we all go through seasons of life where things are different. Things are easier, things are more challenging. So I really want to send the message home of kindly meet yourself where you're at and focus on the small pivots and the wins. With that, we have 5 minutes left. So I want to hear from you. Any questions? Any comments? Anything you want to chat about here? If you feel comfortable, you can take off your microphone and speak, or you can type in the chat. Whatever floats your boat. I know it's a lot to absorb. No questions? Okay. What do you offer to support women? So I could go on about this program that I have. I offer 3 different program options. It is a combination of health and movement coaching. As you can tell, we meet at different frequencies. There are wellness modules that are video-based about sleep, about breathing, everything wellness related. I collaborate with a dietitian to improve my clients' care. There are reflections, there are vision questionnaires, intention settings. And then there's also, this is something I'm adding as of April, I'm starting small group coaching with the group of women who are already there, completely drop-in. It's just additional support that you get from your coach and also a group of women. There's definitely more to it. If this is something you're serious about, we can definitely hop on a call. And also there's a free trial I'm offering. So we can also answer those questions here or in the trial. I hope that answered your question there, Amy. I think there was another question earlier on. Let me scroll. Should we take notes or there's a handout? Jess, good news. I remembered to record this one. So I'm going to send out the recording.
So Michelle, this is Sandra. Hello, everyone. I think this is awesome what you do. And I think, guys, you know, I'm here as not only possibly as a potential client, but to help Michelle support her business, her practice, I should say. My question is this: when I'm thinking of people to introduce to you, a lot of them are already compromised. I have stroke survivors who might be able to facilitate some of what you're doing. I have people who are already dealing with osteo and have already had that fall and probably not properly retrain their bodies to strengthen back from that injury. So how would you address those kinds of scenarios?
Oh, great question. Great question. And right now I'm working with one post-stroke patient. We are focusing a lot on restoring function in one side of her body because her left side was affected. So I treat my clients all the same, regardless of the condition. I meet them where they're at. I assess their physical ability. And then I want to know what their goals are. So for instance, this client wants to be able to get up and off the floor. We're doing lots of like core work, lots of lower body strength work to make that possible. So it's hard to just say they're like condition specific because I'm there to meet the client where they're at and then progress accordingly. So I hope that answers your question. And thank you, Sandra, for being on here today. I'm going to hop to the next slide real quick because Amy asked a really good question. What the heck is involved in this trial? So it's 3 weeks free, a coaching experience. We have 3 30-minute sessions, so 1 a week. There's email coaching in between sessions, and I develop a personalized movement program. It's nothing extensive. It's a max of 3 exercises because anything more we're not going to do. And this is really designed to get a better understanding of your current struggle, discover actually how to move the needle in 3 weeks with accountability, and to perform a movement screen to create that personalized movement program. Okay. So if you are curious about this, what I'll do is I'll throw it in the chat here, a link to book the first session. If I want to be very clear too with this one, there's not going to be any pitch of my program. This is 3 weeks of coaching you. If you want to hear more about the program, you're like, Michelle, tell me about it. I don't want to do the trial. You just want to start, we can do that. Or if you're just curious, you want to know, we can do that. If you're satisfied with the trial and you're like, okay, what's it like to work with this Michelle chick? we'll book another call and we'll go over the program in deeper detail. I really want to be of service to you and help you, again, move the needle a bit, maybe get some answers that you've been really trying to get and work through with the support of a coach. Okay, so if you want to take advantage of that, you can have a visit of that link in the chat. And with that being said, we're at the end of this presentation. I just want to say thank you so much for joining today, for your time, your energy, for your cats, for showing up and hopefully learning something new today. If you learned something new, share it with your family, your friends at dinner, just to show how smart you are. And remember, you can radiate strength and confidence. If there's anything I can do to support you, you have my email, okay? I want to wish you amazing rest of the day. And thanks again.
Very interesting. Thank you.
Thank you, Sandra. Thanks, Denise. Thanks, Jess. Thanks, Shay, Tiffany, Amy. So nice for all of you to join. Bye for now.